I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about how should you sleep when your shoulder hurts. We get this question a lot. We treat a lot of shoulder injuries, some post-surgical, some before surgery, some who aren't getting surgery but just can't get comfortable while you're sleeping when your shoulder hurts. So if you are someone that is getting shoulder surgery, one of the best investments you can make, either rent it or buy it, is a recliner, because it's very difficult to sleep when you have shoulder surgery. And laying flat on your back when you have a shoulder injury, whether it's post-surgical, pre-surgical, not getting surgery at all, that just hurts, is very difficult. Why? Because what happens is gravity will generally pull your shoulder down and back. This will impede some of the blood supply to the area, and that will allow for a little bit more pain, a little bit more ache. So a lot of times people who have shoulder injuries describe not being able to sleep on their back. We've gone over stomach sleeping. If you aren't sure if that's a good thing for you, you can refer to one of the other videos that we have. It's not the position you want to sleep on, especially when you have a shoulder injury. The best position you should sleep in when you have a shoulder injury is actually on your side. And obviously not the side that hurts, but the other side. There are a couple things though that you want to be aware of when you're sleeping on your side. So first of all, you don't want to have two pillows. So I put these two pillows here because what happens is as you slide, I'm going to actually lay down. What happens is you try and hold them in, and you wind up scrunching your neck, and you wind up scrunching your shoulder. So this position is actually diminishing some of the blood supply. So if you wake up with headaches, if you wake up with shoulder pain, if you have numbness and tingling in your hand, that's why. These will slide, and you'll really start to scrunch up to try and hold them in there and bunch them in there. And especially if you have right-sided shoulder pain and you're laying on your right side, it can be extremely painful. So you don't want to have two pillows when you have shoulder pain. You don't want to lay on the side that hurts. What you want to do is you want to find a side sleeper pillow. It doesn't have to be anything special, but you just want to find a thick pillow to cover this. So that way when you lay down, your head is the same. It looks like you're laying down and you haven't moved your head position. You don't want it to drop down like this, and you don't want it to be too highly elevated either. So be careful of head position. That really affects your shoulder. So the second thing that you want to do, now we don't have a side sleeper pillow here because no one sleeps here, so there's no need for us to have it. So I'm going to demonstrate a little bit weird, but what you want to do is then you want to take, so this, we'll say this is my affected shoulder. You want to take and you want to hug a pillow, okay? And you want to have it like this. So this position right here is actually opening up your arm, okay? It's opening up your shoulder and allowing the blood to flow, and allowing that the most amount of blood that can get to the area to flow through. So a lot of times if you wake up and you're stiff and you're sore and you're achy, it's because the blood supply is being a little bit pinched off depending on how the shoulder is. Now, you don't want to lay on your side and then fall backwards, and you don't want to lay on your side and fall forward, which is why you really want to hug a pillow, because it's going to allow that shoulder to stay in position, which is right here, and it's going to allow that arm to open up and to be in a certain position to allow the most amount of blood flow. Now, if you're laying on your back, like in a recliner, you might want to also have a pillow underneath your arm, again, to allow that arm to be a little bit more elevated. But what you don't want to do is you don't want to lay on the affected shoulder, okay? And I know everyone says I'm sleeping, I don't know what I'm doing, it's hard for me to determine, am I on my back, on my side? I understand that. But when you start out the night, the ideal position is to lay on your unaffected shoulder with a side sleeper pillow, so this is filled, okay? And then you want to hug a pillow so that it's elevated and you're getting the most amount of blood flow to the area. If you wind up waking up at night and you're not in that position, just try and get into that position. You may also want to put a pillow between your knees. That may be comfortable, although that's not really going to affect the shoulder at all. But making sure that shoulder is straight up and down, kind of in this open position, allowing a lot of blood to flow. That's one of the reasons you wake up with that stiff and painful shoulder, but allowing a lot of blood to flow and then having that neck in the proper posture is very important also when you're talking with the shoulder about the shoulder, because you don't want to have it too far this way, otherwise you're going to be occluding some of the blood supply or you don't want to have it scrunched up like this. Again, because you're going to be pinching off some of that blood, that's going to cause you to have a little bit of that dull and achiness when you wake up. If you are experiencing shoulder pain and want to come in for a free consultation with one of our doctors of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to help. Thank you and have a good night.